Hi, my name's Cameron. I'm going to be doing a physical assessment today, so I'm going to enter the room, give my patient privacy, perform hand hygiene, identify my patient. Can you please state your name and date of birth?
Madison Partridge, 5/20/99.
And I will check this with the patient's identification band. Today we're going to be doing a physical assessment from head to toe. Are you okay with that?
Yes.
And if at any point you need me to stop, just voice so. Could you rate your pain for me on a scale of 0 to 10? 0 being no pain, 10 being the worst.
0.
Okay. Patient has no pain, so we'll go ahead and get started. Alright, the first thing I'm going to do is put on my gloves, if I can put them on, and then we will inspect the face and head of my patient. So I'm visually looking at the skin, no abnormalities noted. Patient has some freckles, no scars, bruising, swelling anywhere. Can you look down for me? I'm inspecting the scalp and palpating for any soft spots. Cranium is intact. The scalp looks fine, moist, no dry areas noted. Next, I'm going to inspect the face for symmetry. So can you smile for me? Frown. Face is symmetric. I'm going to palpate the temporal arteries, and they are strong bilaterally. Next, I'm going to inspect and palpate the can't remember the name, temporomandibular joint. And now checking for TMJ. Can you open and close your mouth? No popping or clicking sounds were noted. Next, moving on, we're going to be doing checking the cranial nerve 5. I'm going to get you to put this in your mouth, clench your teeth. I'm pulling for resistance. Patient is able to do so. I'm going to move this swab across your face. Let me know if you can feel it.
Yes.
Other side.
Yes.
Okay. Patient was able to perform the task. Next, checking cranial nerve 7. I'm going to get you, I already got you to smile and frown. So can you close your eyes tight, open, raise your eyebrows, clench your teeth, and then puff your cheeks out. Okay. Next, still checking the eyes out. We're going to be doing the visual acuity test. So we're going to be using our eye chart up here. Can you just stand right here? And I want you to cover up your left eye and read the lowest line that you can.
LEFODPCT.
Okay. Right eye visual acuity 2020. Now cover up the other eye. Blink a few times and go.
LEFODPCT.
Okay. Uncover that eye. Blink a few times and do it with both.
LEFODPCT.
Okay. Patient's eyes bilaterally are 20/20. You can have a seat now. Next, we are going to be checking the extraocular movements. These have to do with cranial nerves 3, 4, and 6. So I'm just going to get you to follow my finger. Checking accommodation. Okay. Movements are intact. Next, I'm checking pupil size with my pen light. Just look straight at me. Pupils equal round reactive to light and accommodation. With looking through with my pen light, sclera is white, no jaundice noted or irritation. Iris pupils are intact. Conjunctiva is pink and moist. Next, I'm going to palpate the external areas of the eye and inspect eyebrows, eyelashes, eyelids, all with intact. Palpating. Close your eyes for me. Filling up underneath. Patient does have titanium plate under right orbital from a previous surgery that is palpable, but no tenderness noted. Moving on. Okay, we already did that. We're going over to the ears. We're going to inspect and palpate the external parts of the ears. No redness, abnormalities noted, no tenderness. Patient does have bilateral piercings. I'm going to perform a whisper test. So what I'm going to do is stand behind you and whisper 2 different words behind each ear and just repeat them back to me. Dog. Cat. Patient was able to hear and perform the task. Alright. Next, I'm going to inspect and palpate the nose. Upon inspection, it looks normal, no abnormalities noted. If you're having any pain at some point, let me know. No previous fractures, bone intact, cartilage intact. Can you put one finger over your nostril and sniff in? And do the same thing on the other side. Okay. Patient was able to do so. Next, I'm going to palpate the sinuses. If you have any pain upon palpation, let me know. Palpation felt normal. No abnormalities noted with that. Moving on to the mouth and throat. I'm going to use this pen light to look inside the inside of your mouth. Can you open up for me? Okay. Stick your tongue out. Tongue is symmetric. Alright. I'm looking at your tonsils. Gag reflex noted. Tonsils grade 1, no swelling or irritation. Uvula was also noted. Next, I'm going to evaluate the symmetry as the person sticks out their tongue one more time. And that checks the cranial nerve 12. Moving on to the neck. I'm going to palpate the lymph nodes from standing behind you, and while I'm there, I'm going to also check for the trachea and the thyroid. So when I ask you to take a sip of water, please do. Checking the lymph nodes, I'm starting down at the lower part of the chin and working my way up to feel for any swelling right here above the ears, kind of behind the ears, going down the neck, at the base of the neck, collarbone area, coming up the back of the neck, into the hairline. No swollen lymph nodes. Patient had no tenderness. Now I'm going to get you to swallow while I feel your thyroid. Okay. Thyroid is not enlarged. Trachea was noted normal. Okay. Next, I'm going to palpate the carotid pulse. One at a time. Pulses were equal bilaterally and strong. Now I'm going to auscultate the carotid pulse for any bruits or thrills. Okay. Pulses sounded within the normal limits. I'm going to test the range of motion in your neck. So can you touch your chin to your chest? All right, and look up, bend it backwards. Turn your head side to side, ear to shoulder. Okay, and then look down against resistance. All right, and then here we go. Next, moving on to the posterior chest. So I'm going to be at the back, looking back here. As you can see, the patient has some freckles, moles noted, but no scars or swelling, rash, erythema. I'm going to palpate the tactile fremitus. All right, can you say the word 99?
99.
Okay. Intact, I can feel the vibrations. By staring at the back of the chest, expansion is symmetric and within the normal limits. I'm going to percuss over all the lung fields. Also going to be checking the costovertebral angle for flank tenderness. No tenderness was noted. I'm going to go ahead and auscultate breath sounds back here while I'm back here. All right, take a deep breath in for me. Listening on the sides. Okay, coming to the front, I'm going to do the same thing up front. I'm going to percuss over the lung fields. On the sides. I'm going to auscultate these. All lung sounds were equal. No abnormal breath sounds noted. And we're just going to wait a second for that to go off. Okay, after auscultating breath sounds, no abnormal breath sounds were noted. Strong breath sounds were heard. Moving to the upper extremities, I'm going to get you to hold your arms out for me. I'm going to inspect the upper extremities for any abnormalities or any tenderness. I would ask the patient to remove the jewelry for me to inspect properly. Patient does have fingernails. I'm going to go ahead and check capillary refill. And it is less than 3 seconds. Can you hold your hands out? We are pronate right now. Can we supinate? Flex the elbows up, back down. Flex up with resistance. Patient is able to do so. Now we'll check the wrist. So get you to hold your hands out again. Flex the wrist up for hyperextension. There we go. Flexion. Make a fist. Spread out your fingers. Close them. Okay. Now I'm going to check for pulses. If you'll just hold your arms back like this. Radial pulses were noted. Strong and equal. Ulnar pulses, strong and equal. Brachial pulses, strong and equal. Okay. Let's see. Next, we will also do the shoulders. Can you lift your arms all the way up, around your back, out, into you? Rotation, adduction, and abduction were all within normal limits. Okay. Moving on. We did this, and this. Okie doke. Oh yeah, finger to nose. So can you hold your finger out, touch it to your nose? Other hand. Okay. Now I'm going to do the graphesthesia, and the stereosis test. So can you hold your hands out and close your eyes? For the first test, I'm going to be writing a number in your hand and just repeat it back to me.
7. 7.
Okay. Good job. Next, I'm going to get you to hold your hand out. I'm going to place a random object in it.
Pen.
Okay. Other hand.
Coin.
Okay. All right. Now we will do the reflexes in the upper extremities. So I'm going to get you to hold your arm out. First, we're going to check the brachial radialis. Okay. The bicep. All right, and for tricep, I'm going to get you to kind of dangle your arm. I'm going to hold it up. Okay, other arm. All reflexes were strong. Okay, can you also touch each finger to your thumb? Okay, patient was able to perform the task. Let's see. Moving on, can you lie down for me? I'm going to inspect your chest. I'm going to cover the patient up. Okay. Now, without exposing the patient all the way, I'm looking at the chest for any abnormalities while I'm inspecting. Patient does have a tattoo to the left anterior chest. No scars or obvious deformities noted. Looking at the work of breathing. Patient's breathing is unlabored. No respiratory stress noted. I'm going to inspect and palpate the precordium for any PMI, pulsations, heaves, or thrills. within normal limits. Now I'm going to auscultate heart sounds using the diaphragm of my stethoscope and then the bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Doing the same thing with the bell of the stethoscope. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Heart sounds were normal, no murmurs heard, any kind of regurgitation. Next I'll be looking at the abdomen while the patient is still lying flat. I'm going to pull up the gown to assess the abdomen. Upon inspection, there are no abnormalities noted. Patient has umbilicus piercing. Next, I'm going to get you to cough to check for any umbilicus hernia. No hernia is noted. Let's see, listening to all the bowel sounds. All bowel sounds were normoactive. Now moving on to percussion. So I will percuss. Okay. Percussion was normal. Actually, let me auscultate the aortic and renal arteries real quick. All pulses were strong, renal pulses equal and strong bilaterally. Since I did just percuss, now I'm going to palpate lightly. Now I'm going to do a deep palpation. No tenderness noted, unable to feel the spleen. The liver feels intact. Nothing like an enlarged liver. Let's see, moving on, I'm going to be doing the lower extremities. So I'm going to cover my patient back up and kind of move the blanket up. Okay, I'm going to inspect and palpate first. No abnormalities noted. I would ask the patient to remove their socks to properly inspect and feel the toes and feet. No tenderness noted. Let's see, I'll check some popliteal pulses first, behind the knee. Equal. Posterior tibial pulses equal, and the dorsalis pedis pulses are equal. Okay, while I'm down here, I'm going to get you, can you go ahead and flex your toes, flex your feet up, point them down. Okay, now flex up against resistance, and like you're driving the gas pedal. Good job. Patient was able to perform activities. Next, we're going to check the range of motion in your hips and legs. Can you lift your right leg up 90 degrees, knee to chest, knee outwards, inwards, back up, straight down. Other leg, 90 degrees, knee to chest, outwards, inwards, back up, back down. Can you also point your ankles in and them out? Okay, all within normal limits. No pain. Can you stick your leg out, away from you, back in? Same thing on the other side. Abduction was normal. Let's see. Also feeling for the pre-tibial edema, and no edema is seen or felt. Moving on. Let's see. Let me get you to sit up on the edge of the bed. I'm going to check the reflexes in your lower legs. First, we're going to be checking the patellar reflex up right at the knee. Okay. Next is the Achilles. And then now we're gonna do the Babinskis. Can you hold your feet out for me? Okay, toes did not fan or curl up. All reflexes were normal and strong. Next, can I get you to rub your heel down your shin? Okay, now do it on the other side. Also, now can I ask you to stand up for me? While standing, I'm gonna get you to walk on your heels, your toes. Can you hop on one leg and then the other? Now stand still with your eyes closed, and I'm gonna see if we have any swaying. 1, 2, 3, 4, 5. You can open your eyes. Patient had no problems doing any of this task. Romberg was normal. Patient did not fall. Next, can I get you to face this way? I'm going to inspect the spine. Just feeling no curvature noted, no tenderness. Can you bend down and touch your toes for me? Patient able to bend down, touch toes, spine feels good. All right, now bend backwards. Can you bend side to side? All right, and twist your shoulders. Good deal. That concludes our physical assessment for today. I am gonna ask that you sit down on the bed, and I'm gonna go over some teaching with you on smoking cessation, since you are a intermittent smoker. So today we're gonna be talking about the health risks of smoking. Smoking tobacco is extremely bad for one's health. It contains many toxic chemicals that can damage many parts of the body. Secondhand smoke can also be harmful to those around us. Tobacco and nicotine can cause long-term chronic diseases, and smoking is also difficult to quit because a chemical in tobacco called nicotine can cause addiction and dependence. When you smoke and inhale, the nicotine is absorbed quickly into the bloodstream through your lungs. Both inhaled and non-inhaled nicotine may be addictive. So other forms of nicotine can be like snuff, dip, gum, things like that. Why you should quit smoking? There are health benefits to quitting smoking, and some can happen right away while others take time. These benefits can include blood flow, blood pressure, and heart rate. Lung capacity may begin to improve. However, lung damage that has already occurred cannot be repaired. Temporary respiratory symptoms such as congestion, cough, sinus problems, those can all get better once one quits smoking. The risk of heart disease, stroke, and cancer is all reduced when one quits smoking, and the overall quality of your health will just improve. You can save money because you will not spend money on tobacco products and may spend less money on health-related issues due to smoking. What can increase your risk? Smoking harms nearly every organ in the body. Statistically, over 480,000 people die yearly just in the U.S. from smoking alone. That's 1 in 5. People who smoke tobacco have a shorter life expectancy and an increased risk of many serious medical conditions. These conditions include increased respiratory infections such as colds and pneumonia, cancer, heart disease, stroke, chronic respiratory diseases such as COPD and emphysema, delayed wound healing, and increased risk of complications during surgery and after surgery. You can even have problems with reproduction, pregnancy, childbirth, such as infertility, early or premature labor, stillbirths, and birth defects. Secondhand smoke exposure to children increases the risk of SIDS, which is sudden infant death, infections in the nose, throat, and airways, so respiratory infections, and chronic respiratory symptoms. How you can quit? Smoking is an addiction that affects both you and your body and your mind. Long-term habits can be hard to change. Your healthcare provider can recommend several things. Nicotine replacement products such as patches, gum, nasal sprays. Use these products only as directed. Do not replace cigarette smoking with electronic cigarettes, which are commonly called e-cigs or vapes. The safety of vaping is not known, and some may contain very harmful chemicals. Prescription medicines are also out there to reduce cravings for nicotine. A combination of 2 or more quit methods, which will increase the success of quitting, can be helpful. Where you can find support. Follow the recommendations from your healthcare provider about support groups and other assistance. You can visit the North American Quit Line, and I have listed for you their website. Their phone number is 1-800-QUIT-NOW. The U.S. Department of Health and Human Services website is listed. American Lung Association and American Heart Association with their websites also listed. Where to find more information, the Center for Disease Control and Prevention website, which is listed, and the World Health Organization website, which is listed here as well. So a summary of our teaching. Smoking tobacco is very bad for your health and kills up to half of its users. Tobacco smoke contains many toxic chemicals that can damage all the parts of one's body. Smoking is difficult to quit because a chemical in tobacco called nicotine causes a severe addiction and or dependence. There are immediate and long-term health benefits of stop smoking. A combination of 2 or more of these quit methods can increase your success in quitting. And make sure you discuss any questions that you have with your healthcare provider. Do you have any questions? Okay. Well, that concludes our physical assessment and teaching. We're done.